Hello everyone, my name is Dr. Narmin Hilal. I am an assistant professor and consultant of orthodontics and pediatric dentistry at King Abdulaziz University. Today I will be presenting a research poster about assessment of root resorption on lateral incisors after interceptive primary canine extraction treating mesioangular displaced permanent canines using com beam computed tomography, a randomized controlled trial. I have no financial interest to disclose. Starting this presentation with a background. So untreated canine displacement can cause several complications such as follicular cyst formation, recurrent pain and infection, or canine ankylosis. However, root resorption of adjacent maxillary lateral incisors is considered the most common complication of those displaced canine. It's commonly seen on radiographs, like panoramic radiograph upon examination. Like you can see here, the palatal resorption of the root of the lateral incisors, or here you can see half of the root is actually resorbed. There are few studies that actually looked into the resorption of lateral incisors and actually followed them up right before until treatment. So our goals of the studies was to assess the effect of interceptive extraction of primary canines on the conditions of the root of the permanent neighboring teeth to mesioangular displaced canines. We also wanted to evaluate the association of root resorption with a certain type of displacement. So after sample size calculation based on previous studies, our design followed the concert flow design of randomized trials. We screened 805 patients, and those patients were assessed for eligibility according to our inclusion and exclusion criteria. To simplify it, for the sake of time, we looked at 9 to 10 years of age, 9 to 10 years of age patients with good panoramic x-rays and had mesioangular canines and had clinically the primary canine presence. Those patients that fit our criteria were enrolled and randomized by block randomization and assigned or allocated blindly to either an extraction group or a control group. At baseline, we took CBCT for those patients and did our measurements, and then those patients were followed up for 12 months, and then we retook the CBCT and redid our measurements. Both examiners, we had two examiners, both were calibrated. And we did inter-examiner reliability for them and intra-examiner reliability. Intra-examiner reliability was perfect, and inter-examiner reliability was actually substantial. We used the grading for root resorption criteria according to Erickson and Curl, when we had an intact root, it was graded as grade 1 or no resorption. When we had up to half of the root is resorbed, that is considered slight resorption. More than half, it's considered moderate. Or if we have an exposed pulp, we had severe resorption. So this is an example. We have here panoramic x-ray with 1-3 mid-alveolar, 2-3 is buccally displaced. So this case was we took CBCT at baseline, and then if you look here, this is the grading for the root was grade 1, so we had no resorption in this case. This is another case. I just wanted to show you the more severe cases. This is a palatally displaced 1-3, and here we had grade 3 or moderate resorption, and in the second case, the 2-3 here had actually grade 2 or slight resorption. So at baseline, the prevalence that we found at baseline of our study, we found 41%, and 41% is not a number to be overseen. We also found 58% of the resorption actually to occur in the apical third of the root of the lateral incisors. To answer the questions of our study, the first question, where we looked at the relation between the degree of resorption and the type of displacement, we found it to be not significant. However, where we found a severe resorption, it was either associated with palatal or mid-alveolar displacement rather than buccal, more to be associated with the palatal displacement. Palatal canine displacement. Also, when we looked at the degree of inclination of the canines on the panoramic radiograph, we found it to be that it has no relation with the degree of resorption, like the case I explained before. Although mesially displaced and inclined canines, here we found no resorption on the roots of the lateral. To answer the second part of our question, which was to see if the extraction of the primary canines affected the root of the lateral incisors with regard to the displacement of the permanent canine, and we found the answer to be no. So there was no significant difference in the resorption level from T0 to T1 between the control and the extraction group. So the change of resorption was similar between both groups. However, what was significant, and this was one of our important findings, is that at the 12-month follow-up, we found a significant increase in the degree of resorption between T1 and T0. And that's explained by the table that you see over here. That we had the cases that at T0 had no resorption. Actually, the number has decreased, which means more cases had resorption at T1. And the cases that had slight, moderate, or severe resorption, the numbers you see here, it's actually increased from 11 to 16, 7 to 10, to 2 to 9. And this actually was significant with a p-value of less than 0.0007. Also, when you look at the second table here, you see that, for example, cases with no resorption or grade 1, we had 4 cases that changed from grade 1, no resorption, to actually severe. And we had actually 6 cases that transformed from grade 2 to either grade 3 or grade 4, which was actually significant. So in conclusion, although interceptive extraction of primary canine did not affect the condition of the roots of the lateral incisor and the null hypothesis was accepted, this study found a significant increase of resorption over a 12-month follow-up period in cases with displaced canines. Also, severe lateral root resorption was found to occur more with palatally displaced canines over other displacement, and this was in actually association with other study, or in similarity with other study. Our findings actually highlight the importance of early diagnosis, follow-up, and sometimes considering early treatment for cases with incisors root resorption associated with canine displacement. These are my references. I hope you find my research interesting, and I wish you a good day.